Well, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today we're talking about poisons, overdoses, and a culture of fear in America. Iowa's Poison Control Center is on the leading edge of a wave of new threats and risks that are flooding Iowa with dangerous drugs and substances that impact the health and welfare of all Iowans. Experts are warning us of emerging risks, and if we ignore them, we should fear the consequences. Joining us today is the director of the Iowa Poison Control Center, Linda Kalin, and Dr. Brian Wilson. Welcome to the show. Linda, starting with you, tell us a little bit about yourself.
Okay, thank you, Peter. Nice to be here. So I'm a registered nurse, been involved with Poison Center activities for decades. And we answer calls for all 99 counties in Iowa, from little kids who swallow something inadvertently at home to outside a mushroom in the yard to a snake bite to drug overdoses. So a broad range of poisons and toxins and overdoses. And I'd like to introduce our interim medical director, Brian Wilson. Dr. Wilson is also an emergency room physician at University of Iowa Hospitals and Clinics.
Brian?
Hi, Peter. Appreciate you having us here today. So like Linda said, I'm Brian Wilson. I'm a physician by training and board certified in emergency medicine, pediatrics, and additionally medical toxicology. Recently, the bulk of my time is spent working as the medical director for the Iowa Poison Control Center, but I'm also a clinical assistant professor at the University of Iowa, where I work in the emergency department and as part of our division of toxicology. And through those roles, I take care of a lot of patients who have overdosed on various substances or who are presenting with addiction-related problems. And so I'm excited to be here and have the opportunity to talk with you about that. Not here with us today, unfortunately, is Dr. Dan McCabe, who is also a medical toxicologist and clinical assistant professor at the University of Iowa, and who's currently serving as our associate medical director. He unfortunately was tied up with some patient care issues and sends his regrets.
Well, thank you both for being here. I know you'll do an exemplary job. Let's review what's going on here. These last few years have been tough on people. We've had the epidemics, pandemics, opioid thing going on, and now fentanyl. I mean, and you guys are like at the top of it. I mean, you are the number one authority on these risks as they're emerging in Iowa. Give us a sort of an overview of some of the major ones and what's happening that we need to be aware of.
Well, I'll let Dr. Wilson speak about the clinical effects and the damage that can be done, but just briefly, you're right, Peter. These last couple years, we have seen the movement to fentanyl, right? I mean, heroin being laced with fentanyl. A few years ago, we were basically talking about heroin. We started with prescription opioids. You know, we've had these waves. And now it's fentanyl killing far more people because of its potency. In addition to the substance abuse, drug abuse piece, we have noticed a fairly dramatic increase in simple just drug overdoses due to depression. So not simple cases, just not with the intent to abuse substances, but people are really hurting. There's a lot of depression, whether that's related to being inside and COVID restrictions and so forth. That's not up to me to make that connection. But and sadly, adolescents, particularly adolescent teens and tweens. So we're seeing intentional overdoses to harm themselves, like suicide attempts, taking a bottle of prescription drugs, a bottle of acetaminophen, and so forth. So we've seen both of those certainly increase the last couple of years. Brian?
Yeah, to echo what Linda has said, it definitely, you know, as you identified, Peter, it's been a rough few years for everyone. And unfortunately, that additional stress has pushed a lot of people in our communities to either increased trouble with depression and suicidal thoughts and the associated intentional overdoses that come with that, but also just to kind of recreational substances to try to escape some of those stressors and ultimately either resulting in addiction and the damage that can do to their lives, both personally and professionally, but also resulting in these inadvertent interactions and inadvertent overdoses, with fentanyl being a major component of that. The challenge with fentanyl and with most of these illicit substances are that we don't exactly have great quality control going into these products, as you can imagine. And so even users who are not intentionally trying to overdose, they don't know exactly what they're taking. They don't know what they're getting. They don't know even what's in it, let alone what dose of that substance is in it. And so that has led to a lot of accidental overdose and unfortunately a lot of tragic deaths. Both within the addiction, patients with addiction, and in patients who are just using recreationally.
There are parents that are really touting the fact that their kids overdosed by mistake, by poisoning. They're calling it fentanyl poisoning, and I think that's one of the reasons I wanted to bring us together to talk about this sort of weird space we're in, where it's not the hardcore users as much as a lot of these innocent and accidental as you can call somebody taking a drug. Now we're going to take a short break, and we'll come back. We'll continue our conversation with Linda and Brian. See you all after the break. You don't want to miss this.
The black truck? Hey, Christina from accounting.
Yeah, hi.
Hey, I used to date a girl named Christina.
Oh, really?
Yeah, and then she dumped me for my best friend. You want to see some photos of them that I took?
I don't.
I thought we talked about this, buddy.
Buzzed and overshared again?
Yeah.
Yeah. I'm gonna call a car.
That's a smart idea.
So yeah, I know, that's why I did it.
Hey, you're gonna get back to the top of the mountain.
Does that mean I'm gonna get back with Christina?
No.
Oh.
No.
Every second, 127 new devices connect to the internet. You can feel it happening. Our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. We're talking with Linda Lakin and Dr. Brian Wilson from the Iowa Poison Control Center about the things that hurt and kill Iowans, poisons, and what you need to know to stay safe. Brian, tell us a little bit about why this fentanyl problem is so exacerbating and what the issues are here.
Sure, Peter. So we're definitely seeing a different trend with fentanyl versus what we saw with the previous drugs of abuse. And one of the main challenges with fentanyl is just how potent it is. If we want to kind of visualize what a typical dose of fentanyl would look like, really you're talking about micrograms. So you're thinking maybe a grain of sand or a single piece of salt. And if we wanted to compare that to what the typical dose of something like heroin or other opioids would be, we're talking about 150. We're talking about the order of milligrams, and so about 50 to 100 times more potent, or maybe about a teaspoon-sized amount of that substance. And so you can imagine if you're in a garage or some clandestine lab trying to press fake pills, trying to get the exact number of grains of salt into a product compared to getting a teaspoon of that salt into a product or of that sand into a product is going to be a much different challenge. And a lot of these enterprising organizations do not exactly have the concern or the ability to maintain that level of quality control. And so people who are using these substances don't really know what they're getting into. They don't know what dose they're getting. It can change from batch to batch or even from individual tablet within each batch. And that level of uncertainty is what leads to a lot of the problems that we see. Compounding this is the fact that often fentanyl is being pressed into the shape of pharmaceutical tablets. And so people are confusing them for actual pharmaceutical grade products. They think they're getting a very known defined quantity with industrial level quality insurance practices, and that's just not the case, unfortunately. And then I can turn it over to Linda to talk a little bit about why we're seeing fentanyl make its way into our drug supply.
Sure. So the opium poppy is the key source for drugs like morphine, codeine, and heroin. And we're really replacing drugs that are derived from plants like heroin. Cannabis is also. with these synthetic fentanyl. So fentanyl, we call it a synthetic opioid. That basically means it's man-made in laboratories, not the kinds of laboratories our pharmaceuticals come from that we use in healthcare. But this is major, probably one of the more disruptive innovations in the history of the international drug trade, because now these are pushed out without the labor, the production, the labor intensive cultivating the poppy. You collect its resin for heroin. And so that this is far less labor from lancing the poppy bulb. Again, you have to extract the sap to make the opium. So there's a whole process of needing a lot of people and producing these in a huge lab and in hundreds of thousands of, whether it's pressing the pill or just the actual fentanyl itself, is made a huge difference, and again doesn't rely on that opium poppy.
So basically, we're not only is it easy to make a substance that's totally shouldn't be made and illegal and dangerous, but with the internet, it's very, very accessible, so people can get it easily. Now, Linda, you by your own words, you said you've been with the Poison Control Center for a while now. Have the consequences of experimentation by teens ever been so severe as they are today?
Well, I think, there's where I might have to blame the internet, because I've been doing this for well over 3 decades, a little over 4 as we speak. But cannabis, obviously variations, from obviously all the, it wasn't hemp then, but today wax. There's all different kinds of cannabis today, but those days we didn't have buying drug on the internet. And to your point, you can buy some of these, even the fake counterfeit alprazolam, Xanax, you can buy on the internet if you've got a credit card. Some of these opioids. So that has, I believe, if somebody's got a credit card, I think that's changed this entire accessibility issue to obviously a negative. This is not a positive. We used to see teens abuse drugs, but very different than what was seen in the past. People experimented. Remember, LSD has made a comeback. LSD was popular 60s. Now there's synthetic LSD. You can buy it on the internet. So it's not the LSD that we all know of back then. That's still out there, but there's synthetically made. Again, it gets back to made in a lab, and you purchase it the same way, and packages can be delivered to your home.
It's sort of a sad consequence of all these great power of the media, then provides access to these powerful predators that get into our kids' lives. Well, we're going to take a short break. And when we come back, we're going to talk with Linda and Brian, about what their dedication is really based on and how they're fueled to do this work on behalf of Iowans. See you all after the break. You don't want to miss this.
Multiple studies have shown that marijuana can slow both driver reaction and response time, which can be really dangerous. He's here. He's here. Wait. What? I can't drive. Why? I'm high. Oh.
Every second, 127 new devices connect to the internet. You can feel it happening, our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it With one of the nation's first 10G platforms, we'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking with Linda and Brian from the Iowa Poison Control Center. Now, they are dedicated experts with an important message for Iowans. And one message that's really important is this relationship between medications and a doctor and an individual's relationship with a doctor to get those medications. Can you talk about that and how important these safeguards are, Brian?
Sure, Peter. So one of the things we've talked about is how a lot of these overdoses are happening in patients who are trying to self-treat for things like depression, stress, anxiety. And so they end up getting these substances off the street or from illicit sources in an attempt to treat those kind of underlying mental health issues. And the challenge is by doing that, they're bypassing a lot of the safety regulations, a lot of the safe prescribing practices that are meant to keep our patients safe. And so I think it's important that the best way to avoid this is to avoid the illicit market and to go and speak with your physician, your healthcare provider, talk through your issues and try to source treatment through legitimate, verified sources and avoid the entire issue of contamination, of not knowing what it is that you're ingesting. And so that would be one of our main pieces of advice for that community that is using these as sort of a self-treatment.
You know, Linda, is there a sort of a stigma when it comes to mental health and this self-treatment that makes people afraid to go to doctors? I mean, your Poison Control Center talks to people when they call with emergencies. I would guess that in many cases that step of going to a doctor was missed.
Mm-hmm. I think we've come along. We're getting better. I don't think we're there yet, but we're, 25 years ago, you would never sit and tell your, lunch table that you're seeing a therapist. You have a mental health issue. You're a little depressed. I think today that is getting better, but I do think there are challenges. One that Dr. Wilson pointed out is making sure you go seek the care. The other is actually access to care. There are people that don't have adolescent, for example, adolescent mental health is a very specialized area treating the 13-year-old. We have 13-year-old overdoses. And on occasion, if the medical case is now cleared, presumably the patient now survives the overdose. The other end of the phone, we say to them, of course, the patient needs psychiatric or a mental health consult. And sometimes the other end of the phone in the hospital is, that's going to be a challenge. They may not have access. And in fact, in a timely manner, if they're depressed, they now have gone home from an overdose to harm themselves. What if they can't get in for 2 weeks? Is that okay? So those are some other challenges I think that play out.
Yeah, it's fascinating. I've just seen that Amazon is now getting into the healthcare treatment business, both online and with physical locations. And there's talk that they're going to get into mental health treatment.
I am happy about, I'm glad you brought that up, though. I am happy about that. In fact, our state legislature talked about it, and Congress, and that we're looking at telehealth for mental health. And that's really good, because when you really think about it, and Dr. Wilson could speak much better about this, a physician may need to assess the whole patient, their whole body, and many signs and symptoms. Mental health is often like we're talking today. Tell me about something, what's going on in your life, establishing rapport with a therapist. So I'm real happy to hear there will be possibly growth in that field. So if there's not a provider right there, maybe if at least the patient is okay with it, they can talk to a provider via, like we're doing now, via some kind of virtual environment.
Yeah, there's no doubt. We've had psychiatrists on the show that have said that the greatest impact of virtual treatment has been for the 1/3 of the population that's essentially introverted, that had a hard time, that had a difficult time dealing in public places or going to a doctor's office. So even if it doesn't serve everybody, it's provided an avenue for service for a large part of the population that wasn't serviced. We try to call those little nuggets of good things that have happened through COVID.
Yes.
It's opened up some opportunities.
Yes. And we talk about those here. We're serving the whole state of Iowa. So, I've had a number of virtual lectures, and, it saves people time and obviously money, but to not go as many places. I think we've mastered some of the virtual meetings now. So there are some positives indeed.
Yeah. And I know that the Poison Control Center in Iowa is a model operation that's highly respected by our legislature, and you do a lot more than just answer distress phone calls to make sure the legislation, the services are there to help people. Now we're going to take a short break, and we're going to ask Linda and Brian to share some final comments, insights, and inspiration. Stay tuned, you don't want to miss this.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected. Every second, 127 new devices connect to the internet. You can feel it happening, our digital world expanding with every breath. We're entering a whole new era of connectivity, and Mediacom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back. Today on Surviving Bad, we're talking about the things that hurt and kill Iowans, poisons, and what you need to know to stay safe. Let's see what insights, advice, and inspiration Linda and Brian have to share with us. Brian, starting with you.
Thanks, Peter. So, I think one of the questions we can kind of finish off with is what can we do? How can we address this problem? And unfortunately, it's a complicated problem, and our healthcare systems, our legislator, our Poison Center, all these institutions are working diligently to try and solve this issue. But I think at the individual level, one of the main things we can do is try to remove that stigma from these issues, to remove the stigma of mental health, of addiction, of substance use. And the hope with that would be that these patients, these people don't need to overdose and make their way into the healthcare setting before they get help, that they'll feel more empowered to pursue help prior to finding themselves in a life-threatening situation. And I think it also opens up a lot of doors where we can kind of focus our strategies around what's going to save the most lives and not worry about kind of other concerns. And so I think if I could leave you with one message, it would be to try and remove the stigma from these issues and focus on saving as many lives as we can.
And Linda?
Well, I guess I would close by just a word about the Poison Control Center. It's a free call, so anyone who calls us, it's no cost to call, and we're here 24/7 at 1-800-222-1222. And there's 55 poison centers serving the entire U.S. The Iowa Poison Center serves, again, all 99 counties. It's staffed by nurses and pharmacists, and we have some very complex cases, and we need to involve our physician toxicologist, just like Dr. Wilson. We have a medical toxicologist on call 24/7. So we've had to page Brian at 3 a.m. or call our what we call tox docs, because some of the cases can be very complicated. So if you're wondering what to do, even before, if you're a parent of children under 5, even if you got a plant for some occasion and you want to know if that plant is poisonous, you can call us. If you're planting things in the garden, you wonder if they're hazardous to your little ones, the berries, things like that. So it could be just for information, or a poisoning, or an overdose, or a toxic spill, so a snake bite, all those kinds of things. So.
Now, for people and caregivers, is it safe to say there's a strong correlation between self-medication and mental health issues? And that any kind of self-medication, whether you're talking about a friend you're in school with, or a neighbor, or a relative, should be an indicator that there's an intervention possibility there to get some help?
Yeah, I think that's a fair statement. I think if you find yourself using a substance because you're feeling depressed or stressed, or to try and combat some issue or some symptom you're having in your life, that's worth talking about with a healthcare provider and seeing if maybe there's a better, more formal option to pursue treatment and do it in a safer, more controlled environment. So I think that's an excellent point. Thank you, Peter.
Well, thank you all for being with us today and sharing these important points. And thank you all, our viewers, for joining us today. Check out our website at healthyiowa.org and keep your eye on MediaCom MC22 for our next episode of Surviving Bad, where we explore stories of survival, hope, and inspiration. On MediaCom MC22, your local programming leader.